So yeah, the respiratory examination does not end up there. So one thing, you're also going to go to the posterior aspect. So you're going to move to the back side of the patient. Then you're going to have the posterior assessment. So what are you going to check for this? And the first thing that you want to check, you're going to go to inspect. You're going to inspection, and you're going to check the lymph nodes. Lymph node assessment, very important, because in some respiratory conditions the lymph nodes may be enlarged. For example, someone's having an upper respiratory tract infection. You're going to expect the submental, submandibular lymph nodes, and sometimes in the preauricular and the postauricular lymph nodes to be enlarged. And in cases of lung metastasis, if the lungs now and the lung tumor has started to metastasize up to it's ascending up, you expect also the axillary lymph nodes to be affected. So what are lymph nodes that you're going to assess? You're going to assess the submental, submandibular, preauricular, postauricular,
mental, submandibular, preauricular, postauricular, occipital, posterior chain, anterior chain.
and also the anterior cervical trunk. So, and then after that you go to the next thing, where you're going to do an overall inspection of the posterior wall.
And then you do inspection of the posterior wall, and whereby you inspect for any surgical scars or any therapeutic marks. You can find radiation tattoos or maybe pneumectomy scars, together with other maybe chest tube and drainage scars that you might see. And then you check for any signs of any deformities, spinal deformities such as scoliosis or kyphosis. And then you also check for other type of deformities that you might find. And then of course you have to check if there's equal respiratory expansion that you're also going to check, which is very, very important. Don't forget to palpate for any masses or organomegaly that you might come across, or any sort of tumors that you may see. And after that, you go to percussion. So in percussions, you're going to start from the apices of the lungs. So you're going to tell your patient to start taking deep breath in and out, and then from the apice of the lung, which just lies above the super angle of the scapula. So you make sure in a H ladder shape, you go from left to right and you compare the sound. And then after that, you go to the mid zone of the lungs, which lies just in the medial part of the scapula, and you make sure you do the same thing from left to right when the patient is taking deep breath in and out. And then you go to the inferior lobes of the lungs, in which you do the same thing, and then you finally finish up with the lung bases. So you're going to check for any abnormal sounds. So in case for hyperresonance, you're going to suspect tension in thorax. In case of stony dullness, you're going to escape with something of pleural effusion or hemothorax. And in case of just normal dullness, you might expect pleural effusion or any pulmonary edema.
So after this, we are going to go for something called the auscultation. So I've just drawn something here, which is a representation of the scapula, and which we tend to auscultate the upper zones of the lungs, the upper zones, the mid zones of the lungs, and the lower zones. So I've just drawn this as a rough sketch, which will guide us through where we're supposed to auscultate through the entire point. So we're going to use the diaphragm part of the stethoscope. So this is the superior scapular angle, and then from here you have your medial border, and then you have your inferior border. and then this side is your lateral border. And the same here. So this is your medial border, and then you're going to have also this side, which is the lateral. And the same apply to here. So the upper zones of the lungs will start from the superior scapular area. See, the superior scapular angle. So this is going to be the upper zone. So imagine this is the spinal cord passing down here. The spine passing down here. So on this side here is going to be your first area of auscultation. And that's going to be the corresponding side to this side. So it's like it's going in a H direction shape. And your next point of auscultation is going to be in the proximal third of the medial border of the scapula. So here and here. And then you go down to the proximal. You're going to go to the half border, the medial half of the medial border of the scapula. And then you're going to go to the inferior border of the inferior border, and the lower zone we're going to go through the distal third of the medial border. So these are your auscultation points, which will enable you to actually auscultate the upper zones, the mid zones, and the lower zones of the lungs. I hope that's understood. So what are we also looking for? As we did in the anterior parts of the chest wall, we are looking for any abnormal sounds that you're going to find. So after auscultating the upper, middle zones, and the lower zones, what are you looking for? You're going to look for any abnormal breath sounds. So from this, get used to actually these sounds that you get from auscultation. You need to do as many cases as you can. So go to the word, look for different cases, go look for cases of pleural effusion, go look for cases with pneumonia, look for cases with pulmonary edema, look for cases. Just make sure you do as many, so you'll be able to differentiate between the normal type of breath sounds and the ones which are abnormal to you. So having seen this marks the end of our presentation today. In the next session, we're going to be discussing about the central nervous system. So do not dare to miss. So I will encourage you to visit our page on YouTube at 255 Health. Make sure you visit the page, make sure you subscribe and you turn on those notifications so that you'll be the first person to get hold of these videos. Yes, as semester 2 examinations are fast approaching, these clinical exams are really critical for us. So it carries over 60% of the marks, and I want us to get as many as we can. So before I say goodbye,
and kindly drop a topic that you think we should cover next. Till we meet again, have the best of days.